Welcome. I'm Heather Johnson, Assistant Professor at the University of Pittsburgh School of Pharmacy and PGY-1 Program Director for the UPMC Presbyterian Program. The Mastery of Teaching Certificate Program is a hands-on, action-based program for our residents. It begins the year with some didactic experiences, what our residents learned through mentored teaching opportunities, both in the classroom and in the clinical setting. Our curriculum is built upon disease state modules in which our students learn the medicinal chemistry, the pharmacology, and the pharmacotherapy. Our residents have opportunities to teach in all of these areas. Moreover, our curriculum is heavily weighted in terms of hands-on experiences through simulation, standardized patients, standardized colleagues, and our residents have opportunities in these areas as well. Our Mastery of Teaching program includes a didactic phase in which residents are introduced to educational theory as well as the development of means of assessment of teaching activities. In the active portion, our residents are tasked with developing lectures as well as active learning sessions for both practice and assessment. Our residents then get to have more mentoring in terms of the development of their activities through one-on-one as well as small group sessions with mentors and other residents where they share and build on their shared experiences.
In pharmacy school, most of my professors were practicing clinicians in hospitals as well as adjunct professors on the side. And so I thought that's something that I want to do. I want to have the best of both worlds where I'm treating patients but also keeping up with what's coming out and teaching future pharmacists as well.
So a few of my teaching experiences involved some didactic lectures. I was able to give a lecture on burns and the treatment of burns to our P1 self-care class. I was also able to discuss angina and other cardiovascular pharmacotherapy with our dental students at the University of Pittsburgh. And I also had opportunities for small group facilitation, which involved a critical care case with P3 pharmacy students. I also helped with a simulation experience in acute decompensated heart failure, which was a really great opportunity as a PGY-1 pharmacy resident because I knew at that point that I wanted to pursue a PGY-2 in cardiology. So this gave me experience educating in an area that I was passionate about.
At most of our residency sites, our residents will serve as the primary preceptor for a Pitt student on one of their first rotations.
I also had the opportunity to precept P4 API students, and due to the COVID pandemic, this was all moved to a virtual format. So we worked on de-identifying MICU patients and giving these to our P4 pharmacy students, and we would meet with them daily to discuss pharmacotherapy recommendations. We also gave topic discussions via Zoom. We have so many different teaching opportunities available. You will definitely find lectures in transplant, cardiology, critical care, whatever your primary interest is, and it will really help you stand out as a candidate when you're either applying for jobs in that area or PGY-2 specialties.
I would highly recommend the program to potential candidates, especially if they want to precept in any way. I had a patient on Tuesday that we were changing the medication time administration for her, and so to make sure that she understood when to take her medication, I had to make sure that what I was saying was understood, so I had her teach back to me exactly what I taught her about switching her medication time.
I think our program stands out because of the hands-on nature and the active mentoring within our program. Our residents don't just sit in a lecture and learn about teaching. They actually are doing it with their mentors and with their peers. They're interacting with real pharmacy students, developing real lectures, and not just doing something through an interactive web-based design. You will come out of our program with a teaching portfolio that can showcase your abilities to teach in the classroom as well as at the bedside.